All right, now that we have done the mouth, we're going to place our frog in our dissection pan, ventral side up. Remember, that's your tummy side. And we're going to make a Y cut. So we're going to start at the groin region. And we are going to, you can kind of see a line going down the abdominal. We're going to make our first Y incision this way. Staying extremely superficial because the skin is very thin on frogs, almost like paper. And then coming up through here. We can see the separation line of where we would see the diaphragm at. So we don't want to go into the thoracic cavity. We want to stay in the abdominal cavity. We can see that nice thin layer of skin. And a couple things, as we gently peel this back, we can see a few items right here. These are nerves. These nerves allow for sensation and movement. The dark lines that you see going through the skin would be your arteries and veins. See our nerves right down here, bottom. And then we can see our muscles. In us, this would be considered our six-pack or our rectus abdominis. Our obliques would be on the sides. We, however, need to open this flap up just a little bit. So again, taking scissors, we are going to cut through the abdominal muscle. Again, very superficially. I'm staying just to the left of the line for the rectus abdominis and cutting upward. You can see we now have a nice opening to the flap. We want to remove the protective covering known as the abdominal muscles so that we can see the underlying materials underneath. Because we are doing dissection so that you can see it, these are actually going to be cut away. So I'm not leaving these on and pinning them down. I'm actually cutting these flaps and removing them. We can see the abdominal cavity starting to open up and appear. The blackish material that you can see in here, that's blood. And so now we can see a visible abdominal cavity. A couple things that we should see right away when we open the abdominal cavity that's very easy to see. This large organ laying on top, that's our liver. The liver is a very large organ. We can see a black dot in the middle of the liver. That is the gallbladder. And from there, we can see just slightly underneath our stomach and intestinal tracts. So let's open this up just a little bit so that we can see all the portions of this. So I'm going to take at the very top here, I'm going to cut this open. Now, I don't have any fat bodies hooked to my little guy. Fat bodies would be yellowish in color. This guy is pretty thin. Doesn't have a lot of fat to him. I'm going to cut the liver very gently out and tease that out almost with my fingers. Mainly because I don't want to get the gallbladder with it. We can see here that it's connected to the top. The liver is the filter system of the body. It's very important. It takes toxins. It is the one organ that if you do not have, you will die. Ooh, look at that. I have a female. Look at all those beautiful eggs right here on the sides. I'm going to take this liver out though. It's connected tissue. The connected tissue, if we can see that, it's almost translucent. Looks like little paper. And we can cut those. Once I remove the liver, I can see on the back side right there, this is the gallbladder. The gallbladder stores bile and releases that into the small intestinal tract. Pretty darn cool. I'm going to set my little liver right here. From that, you can see the esophagus coming down right here. And then it connects to this long J-shaped item, and that is the stomach. The stomach first hooks to the small intestinal tract and then will wind its way down to the end, and that's the colon, all the way down here. So let's start. You can see the sphincters create creases. We have the opposite effect for this. So that's kind of cool. My stomach is very muscular. It might have some stuff in it. I actually want to find out and see. So I'm going to cut here. We can see the connective tissue on both sides of the stomach. I'm going to cut right at the base of the esophagus before the diaphragm, pulling this out. Here's our stomach. So I'm going to take and just start at one side of the stomach and open it up. Let's see what we got in here. So when I open the stomach up, you can see I do not have a lot of contents in there. However, I'm actually going to completely dissect the stomach in half so that you can see both halves of the stomach. Get those up a little closer. You can see the stomach has some wrinkling in it. That's on purpose. It allows for the increase of surface area. Remember, chemical digestion does need some movement called peristalsis. In order for this peristalsis to occur, the stomach must contract, slushing all its contents around. The black stuff that you see inside of the stomach, this stuff is the material that we are eating and digesting. So that is our stomach. Set that off to the side here. From there, we have our small intestine connecting down to our large intestine. One thing that's pretty cool about our small intestine, and our large intestine, you have this little clear material right here. Pulls apart like paper almost. That's the mesentery. That is what is pulling those nutrients. It's linked to the capillary system. It's how we get our nutrients and waste transfer from our digested materials into our circulatory system, and from our circulatory system back into our colon. This whole part here is your small intestine. We can stretch it all the way out. And then it hooks to the large intestine. You can see the gap where it starts right here and then goes into the small intestine or the large intestine. This is considered the colon. This is where we have excrement formed. I'm not going to open all that up just because there's a lot of stuff that I don't want to be playing with poop in. Now, I'm going to cut one more cut for the Y cut down to the arms. There is our reproductive organs. And we can see very clearly in here before we go anywhere else, because I have a lot. I have a female. And so in my female, you can see all of this. These are eggs. All of this black right here are eggs. They don't necessarily look like they've been fertilized. However, it is hard to tell. And we have it on both sides. So this is a female frog. She does have a vast amount of eggs in her. So I'm going to remove some of these eggs. And if we go down to the bottom, we can see this connective tissue. So I can just pull gently. Oh, beautiful. We can see the yellow right here, the ovaries. So I want to be very careful. So I'm just pulling those out and nothing else. Using my tweezers to do so. Oh, I do have some fat bodies. Awesome. And so we can see here our eggs and our ovaries. There we go. The yellow would be the ovaries, the black are the eggs. So they are amazing. Very well done. Okay, we said I didn't have a lot of fat. here are some fat bodies. Fat is usually associated with the eggs. And so if we can see here, those are fat bodies. If I crush them between my fingers, they're actually going to leave like an oily, yucky residue. That's how you know there's fat inside of them. Kind of gross, but yet so very cool. Let's continue our journey. We got some kidneys to look at. So on the back side, I'm going to remove some fat bodies. So we have a couple things. That's a lung right here. This would be a lung. It's not very... This is a lung right here. They're very lobed. On the back side here is our kidney. Again, these are different than animal kidneys. We'll have it on the opposite side as well. And so we have all the way in. I got to cut up just a little bit because we need to see our heart. We are not going to get into the brain. Oh, and then I do the worst thing ever. I cut my heart in half. I didn't say very superficial. You can actually see this is the heart here. I cut my heart in half. I apologize for that. You can see it's kind of a brownish color, and that's on purpose. There's blood in there, and so as that blood would dry, that's where you get that coloration. And then these are the lungs on both sides, here and here. They're lobed down a little bit further than what we would see, and that is for one reason. That is for the fact that they will need to have oxygenated through the skin as well. Ooh, I forgot this little peanut thing right here. That is our spleen. Looks like a little pebble just hooked to the digestive tract. That doesn't really make sense. It's like a little lump just hanging out. Just rip it out. That's our spleen right there. Again, I said we are not doing the brain just for time purposes. However, I do want you to look at the nervous system. So I'm going to pull the spine, this stuff out, so we can see our spinal cord on the back side. Notice I don't need to use a lot to remove that. And so here is what we have. We look at the spine. Do you see these branches coming off of both sides here? Coming down? These are nerves, arteries, and veins. And so we will always have arteries running with nerves within your arms and stuff, just so that they have a little bit of safety. So if we pull this apart, right here, these string-like, beautiful, these guys right here that look kind of like piano strings, that's a nerve. And we can see that. That sends muscle contraction and relaxation information. They also send impulses to the autonomic and sympathetic and parasympathetic nervous system, allowing for digestion to take place and other processes. Ooh, I'm so close to that central nerve. We can see the brain going, or the nervous cord, spinal cord going all the way up. We are members of the phyla chordata, so we do have a spinal cord. I'm going to cut through the bottom jaw so we can get there. So if we remove the palatine bone, we can actually get, this would be the bottom of the skull here. We are not removing that. So that is our frog dissection, and we can see that beautiful spinal cord right there. Lovely. All right. I hope you enjoyed. Until next time.